With the rollout of NHI, Labor Minister Shane Gibson addresses many of the concerns from stakeholders. We'll bring you all the details coming up in the Bahamas tonight.
NIB inspectors sharpening their skills in a workshop today.
And find out why a triple murder trial has been adjourned. The Bahamas Tonight, the National Report, starts now.
Now in HD. ZNS Network presents The Bahamas Tonight. This portion of the news brought to you by BTC Every Day.
Today was the first day of the National Insurance Board's registration drive for national health insurance. Good evening, everyone. I'm Charisma Robinson.
I'm Keishla Adderley. Thanks so much for joining us. Well, the new NIB Smart Card is the instrument being used to register for NHI, and 6 centers here in the capital have already been activated. Officials tell us operations on day one were slow as residents trickled in to the designated centers for processing.
While acknowledging the criticism of the plan, Labor Minister Shane Gibson told our Janae Noel Ferguson that he anticipates Bahamians and other stakeholders will identify the benefits of national health insurance and buy in.
Registration centers open throughout the country today for legal residents to sign up for their new NIB Smart Card, the tool being used to register Bahamians for national health insurance. But senior consultants and physicians have reportedly decided not to support NHI. Minister with responsibility for NIB, Shane Gibson, said those in the medical industry opposing the plan are simply watching their bottom line.
If they think that making the mighty dollars more important than saving lives, I can't kill them for that. Everybody's entitled to their opinion. If you have, for instance, 1,000 doctors and 50 of them say we're not going to support it, is that buy-in that you need? I'm saying is we have medical doctors on staff at all of our healthcare facilities. We have medical facilities and healthcare providers who said to us publicly and privately they support it.
There have also been reports from stakeholders who claim that information on NHI has not been forthcoming from the government.
I've been in meetings with stakeholders who I saw in the papers subsequent to that who said that they had no meetings with us. And so no meetings and no consultation in my mind to them means if I can't have it my way, then I'm going to tell the public I'm not a part of the process. If anybody knows Prime Minister Perry Gladstone Christie, he is huge on consultation, huge on it. And he made it clear that nothing will happen unless you have widespread consultation with all of the stakeholders.
And while insurance companies are also not agreeing to NHI, Minister Gibson confirmed that the government intends to prepare to compete with them only if there is not sufficient support.
And what we will not allow anybody to do is hold us hostage. And so if you have healthcare providers who are telling you now we're not going to participate, why should we not prepare for it? They're telling you we're not going to participate. And we must just roll back and decide that we're not going to prepare. And so if all of the providers give access to everybody as we anticipate, then we would have less of a role to play.
Turnout was slow at registration centers today, but Bahamians who are registering say they support the initiative.
Here, national health is really, we need it. We do need it.
What I'm looking at too is seeing that it's going to benefit a lot of Bahamians in terms of who can afford private health coverage. So I support it because I want to benefit from it also.
The next phase of the plan includes access to primary care. Gibson says catastrophic cases will also be included.
Do you think the government will just say, oh, you have colon cancer, we're providing health care, you could go home? No. The idea is to create a special fund where we are able to assist those individuals when you identify illnesses beyond what primary health care would provide for.
Now, only about 150,000 persons have received their new NIB cards, which will automatically register them for the government's National Health Insurance Scheme. Officials say they're targeting some 207,000 persons, hopefully to have them registered by April of this year. Janae Noel Ferguson, ZNS Network News.
Well, the next phase of the National Health Insurance Plan is the primary health care phase, which includes doctor visits, prevention services, diagnostics, and medication through a primary care provider. all at no cost for legal residents and no new taxes being imposed in the initial phase. The NHI Secretariat confirmed in a statement that government will pay for all primary service health costs through general revenue collected by the Ministry of Finance or the Consolidated Fund. Full benefits, including catastrophic care for major illnesses, will be included as the program progresses. Those who currently have private health insurance can maintain their current policies if they choose. However, it's possible that your policy may change given that primary care will be covered by government. Additional health insurance could be topped up to your NHI coverage. Enhanced capacity in the health sector will also be realized because NHI beneficiaries will be allowed to choose providers, that is, from the public or private sector.
And still on national health insurance, strengthening medical resources nationwide is another major component of the plan. That includes extended public clinic hours, improvements to clinics throughout the country, decentralization of ambulances here in New Providence, accident and emergency improvements at Princess Margaret and Rand Memorial Hospitals, as well as opening additional rehabilitative and mental health facilities. Labor Minister Shane Gibson added that many hospitals in Abaco and Exuma, funded by the National Insurance Board, are almost ready to open, which will fall in line with the improvements taking place nationwide.
Facilities are about 98% completed. They're just fine-tuning. I think the Siemens is supposed to be coming the end of this month to install the final pieces of equipment in the lab. Once that final piece of equipment is installed and we go through our check-off list, then we will be officially turning those facilities over to the Ministry of Health or the Public Hospital Authority.
Website www.znsbahamas.com asked the question, is majority rule significant to you? Well, after 1,091 votes, the results are in. 1,012 said yes, 78 said no, and 1 said no opinion. This week's question asks, would you keep your private insurance when NHI is fully implemented? You may log on to www.znsbahamas.com to cast your vote. Results will be revealed on Friday.
Officials from the National Insurance Board began a two-day compliance symposium at the Paul H. Farquharson Conference Center this morning. The event assembled NIB inspectors identified as the organization's foot soldiers. They are only sanctioned to examine business records and interview employees, ensuring that the business is complying with the National Insurance Act. National Insurance Board Director Rowena Bethel explains.
NIB is an almost $2 billion outfit. Consequently, the traditional linear singular approach to dealing with important developments is very much a thing of the past. Parallel tracks are the imperative that is our reality. It is inevitable, given our size and complexity, that a number of important action items will often require simultaneous attention. This means simply that our multitasking skill set must be put to work so that all important actions receive due focus and attention according to their specific needs.
Minister of Labor and National Insurance, the Honorable Shane Gibson, also addressed the inspectors, noting that despite their best efforts, more must be done to ensure the sustainability of the National Insurance Board Fund.
There are still far too many potential beneficiaries that are finding out many years after the fact that contributions have not been paid on their behalf. This abhorrent practice is made that much worse since, in many instances, the employees would have had deductions made from their salaries for national insurance. As we embark on a new year and set new goals, NIB must apply its resources in a manner which helps to improve the overall level of compliance, instead of just meeting targeted budget in this regard.
Prime Minister Perry Christie travels to Jamaica tomorrow to address the first session of the Jamaica Stock Exchange's Regional Investment and Capital Markets Conference 2016. The conference is being held under the theme Reaching Beyond Traditional Boundaries, Exploring and Partnering for Growth for All. Prime Minister Christie will address the topic Positioning the Caribbean in the International Arena. That's set for 9 o'clock tomorrow morning at the Jamaica Pegasus Hotel. The three-day conference features premier financial financial stakeholders from countries including Belize, Panama, the United Kingdom, and New Zealand. Jamaica's Prime Minister Portia Simpson Miller will officially open the conference this evening. You're invited to tune in to the Bahamas tonight, the National Report tomorrow, for coverage of the Prime Minister's contribution.